Welcome to the 30th Annual Child Abuse Forum and the first virtual forum. My name is Marshila Harris, and I am the BSW Program Director with the School of Social Work at Indiana University Northwest. I am joined this morning with my co-host, Elizabeth Guzman Arredondo.
Good morning, everyone. I'm so glad that you're here. Obviously, we've gone virtual, and I just want you to know that every Friday from here on until October 30th, we will be providing a webinar to you. It'll be an hour and a half, and just so that we could cover all of our bases and make sure that you have the information that you need. We're just very excited to be here and to provide you with this opportunity to come in and listen to our speakers. There will be an opportunity for you to receive a certificate of attendance after each one of our webinars. The information will be placed in your chat box. You could press on that link after the actual webinar, after the speaker, and print off a certificate of attendance for yourself. Now, we are also providing CEUs for those professionals that require them, and I'm going to allow Marshila to let you know Dr. Harris, to let you know how to obtain your certificates of attendance, or your CEUs, I'm sorry.
Thank you, Liz. So we will list the instructions for requesting your CEUs at the end of each workshop session. And once you submit your email address that you've registered with, you will receive a CEU with your name on it. If for some reason you've experienced any problems this morning, either locating a CEU or requesting a certificate of attendance or any other problems that may occur, please send a message to us in the chat box and someone will assist you immediately. Just a reminder that everyone should have their cameras on mute, your microphones on mute, so you can pay attention and have undivided attention to our presenters this morning. Okay. I now have the honor and pleasure of introducing our new Chancellor, Ken Awama. Ken was named the 7th Chancellor of the Indiana University Northwest Campus by the IU Board of Trustees, and he began his tenure with IUN on August 1st, 2020. Ken previously served as the College of Staten Island's founding Vice President for the Division of Economic Development, Continuing Studies, and Government Relations. In addition to providing diverse educational programming for 4,000 pre-college, professional, certificate, and matriculated students, the division supported faculty research and innovation, government relations, corporate and foundation engagement, specialized student career services, student residential life, workforce development, auxiliary services, and community-based centers and programming. Ken holds a BA in English from the University of New Hampshire, an MA in Labor and Employment Relations from the Rutgers University School of Management and Labor Relations, and a JD from Seton Hall Law School. We are delighted to have him on our campus and as the new Chancellor. Please join me in welcoming Chancellor Ken Awama.
Thank you so much, Dr. Harris, and I'm so pleased to be here this morning as part of this seminal event, the 30th Annual IU Northwest Forum on Child Abuse and Neglect. So happy to be here. In thinking about what I was going to say in my brief welcome remarks this morning, I decided to harken back to my initial message to the campus and community on my first official day at IU Northwest. I would like to share with you the following brief excerpt from that message, which focuses on our critical role in serving as an anchor institution for our communities, which I believe has particular relevance to today's forum. So, quote, "For my very first visit to campus, I knew that IU Northwest was a place I wanted to call home. I found at IUN dedicated faculty and staff united in providing students with life-changing learning experiences through excellence in teaching, research, scholarship, and performing in creative arts. My passion is not only in supporting this student-centered academic experience, but also in integrating this incredible energy with our broader communities to create sustainable collaborations and partnerships that will elevate both campus and community. Indeed, the global pandemic and emerging social justice movements directly impacting colleges and universities across our nation are vital reminders that we must always be prepared to respond to the critical societal issues of our time, end quote. I can't think of anything that better exemplifies the noble concept and practice of meaningful community and university engagement than the annual IU Northwest Forum on Child Abuse and Neglect. Today, we celebrate a remarkable 30 years, 3 decades of community partnership where the knowledge and resources of many vital advocates intersect, ensuring that our region's children, our future, are both protected and loved. I want to deeply thank Professor Emeritus Rick Hugg for his vision of establishing this forum back in 1991 and for his continued commitment to this cause and conversation. I'd also like to extend my gratitude to the Forum Planning Committee, or IU Northwest team of the School of Public and Environmental Affairs, the School of Nursing, the School of Social Work, and the Center for Urban and Regional Excellence, our great hosts and great speakers today, and many of our wonderful community partners who have come together to support this forum. And while we're all making history by participating in this first ever fully virtual event, I do greatly look forward to meeting all of you in person much sooner than later. So thank you for all that you do. And now it is my pleasure to introduce the CEO of Prevent Child Abuse Indiana and the Villages, Sharon Pierce.
Thank you so much, Chancellor Awama, and welcome to our community, welcome to our state. You talked about the need to respond. If ever there's a group that is aligned with that, it's those in Child and Family Services and Child Welfare who are gathered today. And thank all of you. I know all of us who have such a long history with this event are sorry that we aren't seeing one another, sharing a cup of coffee together in the hallway or out in that gorgeous patio at IU Northwest, but we're also so thankful for the perseverance of the Planning Committee and Dr. Rick Hugg to make sure that we didn't miss a year in Northwest Indiana. Dr. Brene Brown is one of my favorite researchers and storytellers, and she has a great quote about connection. I define connection as the energy that exists between people when they feel seen, heard, and valued, when they can give and receive without judgment, and when they can derive sustenance and strength from the relationship. And in my mind, that's what today is all about, connecting those we are so privileged to serve to one another, to resources in the community, and to a system that's going to be transformed. So it's my pleasure to introduce my wonderful partner, our wonderful partner in the public sector, Director Terry Stigdon, the Director of the Department of Child Services. You know, it's often said kindness is a gift that all of us can afford to give, and Terry just exudes kindness, just as all of you do, but it's in the spirit of kindness and leadership, Terry, that we turn the mantle over to you, and we thank you for your leadership and your commitment to a collaborative public, private, educational, and judicial system that is better for children, youth, and families, one that I know Jerry Milner is going to challenge us to continue to enhance. Terry Stigdon, Director, Department of Child Services.
Thank you, Sharon. That was very kind. This is exciting, and it's a privilege to serve in this way. You know, here at DCS, we're looking at not only how to improve the system by removing red tape and decreasing frustrations, but really how to apply a holistic approach to how we should be working with families. The key phrase is working with instead of doing to. And we have an opportunity, and dare I say an obligation, to redesign child welfare into a system that seeks to support the whole family, to shift gears from being a rescue and removal system to a strengthening and supportive system laser focused on the well-being of families. All children do deserve to be in a safe, stable, and permanent family. That is true. No one will disagree with that. All families do deserve the chance to raise their children successfully and safely in supportive environments. Let's not forget that. So in Indiana, all of us in the system need to be on the same page, as Jerry Milner said recently, to chart a different course to strengthen families through primary prevention. We must be bold in our demanding and driving this transformational effort. Speaking of Jerry Milner, I did have the chance to meet him last year and have recently had the opportunity to speak with him about our new model called Family Preservation Services, which is designed to do everything we can to support a family safely and supportively raising their own children. Whenever Jerry speaks, I am fully engaged and left with a bold call to action to continue changing what is currently in place. And it is my distinct honor to introduce him to you today. Jerry Milner is the Associate Commissioner at the Children's Bureau. He has worked in child welfare at county, state, and federal levels, and in the private sector for over 40 years. Prior to returning to the Administration for Children and Families, he served as the Vice President for Child Welfare Practice at the Center for Support of Families, where he assisted state and local child welfare agencies in evaluating their child welfare programs and designed and implemented improvements in practice, policy, and procedures. Jerry was also the State Child Welfare Director in Alabama. He worked previously in the Children's Bureau to implement and manage the child and family service reviews of state child welfare service programs. Thank you for that, Jerry. Now, Mr. Jerry Milner, everyone.
Thank you incredibly for that, Terry. Actually, to get us started this morning, my closest colleague in the Children's Bureau, David Kelly, is with us, and he's going to get this session going here. So I'll turn it over to David.
Thank you, Jerry, and good morning, everyone. It's a pleasure for us to be with you. We do, of course, wish we could be in person, but we'll make the most of this opportunity. And there are some silver linings. Instead of being in a conference room that's either too hot or too cold, we're all, or many of us, are more comfortably at home, not wearing suits, closer to coffee, and we might actually get the chance to meet some of each other's pets. So here we are. You know, we're living through a time when compassion and understanding and kindness is perhaps more necessary than ever before in recent history. And the need for those things are for ourselves as well as those that we serve. You know, compassion, kindness, understanding, these are very basic human needs. They're needs that should transcend politics, and they're needs and principles and values that cut across or are foundational to most faiths, and they're principles and values that are essential to justice and equity. We'd like to frame our time together this morning by doing a little bit of reflection together, if you'll indulge us. And we'd also like to spend some time thinking about words and how words shape thoughts and thoughts shape actions. For over the past 3+ years now, prior to restrictions on travel, Jerry and I have had the incredible opportunity to travel the country from coast to coast repeatedly. And we've met with parents who have lived expertise in child welfare, and we've met with young people with lived expertise. We've also met with the workforce and those that have dedicated their lives and their careers to serving children and families. And we'd like to spend a little bit of time grounding ourselves in the experiences that parents who have had children in foster care and children and young people who have been in foster care themselves have had. They share their stories with us. We don't ask them to do this. When we meet, we ask them to share their expertise. But inevitably, stories are shared. And the people that we meet with recount hard and often tragic situations. They also speak about resilience in overcoming odds. Some of the people that we met with on our journey were in much better places than when their lives led them to the doors of the Child Welfare Agency, but others frankly were not. All people that we had the honor to meet and speak with were unfailingly open and honest. And the conversations often reflected a range of difficult emotions and tears, grief and shame, and sometimes anger. There was also times where gratitude was expressed and there was some evidence of healing, but not nearly as often as I know any of us would like to hear. You know, trauma was ever present. It permeated every conversation, and frankly, there were mountains of trauma among parents, among young people, and among those there to serve them. So what we'd like to do as we start our time together is reflect, and specifically reflect on the words that you think we most commonly heard, the words that young people and parents with lived expertise in child welfare most commonly used to describe their experiences. I'd like to be quite literal about this. So I invite you all just to take 10 or 20 seconds to yourself and think about what those most frequent words were. And for those of you who are comfortable doing so, I'd also invite you to begin entering those words into the chat function. How would you expect parents and young people who have experienced the child welfare system to describe it? What words would they use? Go ahead and type them into chat. Traumatic, scary, intimidating, frustrating, saved, rescued, overwhelming, stressful, changing, terrorized, despair, out of control of their lives. Not heard, distrustful, uncertain, overwhelming. Forgotten, broken, alone, guilty, misunderstood. Yes, these are the words. These are the words we've heard in person in over 40 states, virtually, I'm sure by now in every state. These aren't the words that any of us went into the work to achieve. These aren't words of healing. These aren't words of compassion. These aren't words of justice. These are words that reflect the same sentiments that were shared by Sharon in the introduction. These are words that people use when they feel unseen, unheard, not valued, judged, misunderstood, and less than. It's somber and troubling. But we have great hope that we can change these words. We can change these words to words that reflect experiences of a compassionate system, of a system there to help, to support, to empower, to listen, and to act on what we hear. So what I'd like to do now is end in a slightly more optimistic way and invite everyone to enter the words into chat that reflect why you are in this. The words that reflect your values, the words that reflect what you hope and intend parents and young people to feel. Compassion, restore, rebuild, grace, love, empowered, hope, comfort, and courage, understanding, transformative. Hope, love, acceptance, healing. Yes. These are the words we believe incredibly strongly we can achieve together. They're possible. And now we'd like to talk about how we can work to achieve them together. So I'll turn it over to Jerry.
Well, good morning again. And thank you so much, David, for getting us started out in the right direction here. And thank you again, Terry and Sharon, and all of you for the incredible work that you're doing in Indiana. And I want to congratulate you, as you have already been congratulated by our Assistant Secretary, for the tremendous work that you're doing in the area of adoption, for receiving the Adoption Incentive Award, and for the tremendous amount of well-deserved publicity that came with that. David and I are incredibly happy to be with you today. Obviously, we'd rather be with you in person, but we're all adapting and we're trying to make the best out of a very unusual situation that we're all facing here in our country right now. Before the pandemic hit, we actually had 3 separate trips planned to Indiana, including for this meeting, and obviously had to find alternate ways to participate. But at some point, it's still our hope to be there with you in person. David said how much we appreciate all of you and all of the work that you're doing. Your jobs have never been harder. We understand that, but they've also never been more needed. And it comes at a time when our own families and communities need us as well. I commend you for carrying on with your broader efforts to change the face of child welfare in Indiana. It'd be very easy, I think, for improvement, change efforts to get lost in all that is going on. But quite to the contrary, we recently had a briefing with Terry Stigdon and David Reed on the prevention work that Indiana is doing through the Family Preservation Program. And we were so deeply impressed, not only by the work that's occurring, but by the commitment that we sensed and the enthusiasm that's there on the part of the department and providers to ensure that families get what they need, where they need it, and when they need it. You all should be, and I know you are, really very, very proud of that work that's going on. It's hard not to keep coming back to the difficult and challenging times that we're facing right now. David and I have done so much reflection on the issues that are emerging through the course of this pandemic, and how those issues relate to this vision of a completely reimagined child welfare system that we've been promoting for over 3 years now. I would say that if we've learned nothing as a country during the course of the pandemic. It's that everyone needs help sometimes, and that asking for help is actually a sign of strength. Disasters, whether they're public health disasters or natural disasters, also show us what's possible when communities come together and rally around their families, as they have done, I'm sure, in Indiana and all around the country. But you know, it shouldn't take a disaster to remind us of this. We believe very strongly that child welfare can be reshaped to strengthen communities and to rally around families at all times, and to prevent challenges from becoming catastrophes, to build people up so that they are not so easily worn down. At the Children's Bureau, we firmly believe that family and community are the most important types of support that exist out there. And it's time for us to reflect on how we make our investments and spend our money, especially at the federal level. So with that in mind, I'm here with a message that we believe is incredibly urgent, but it's also a message, as David has alluded to, of hope. We have long said that the traditional and current trajectory of child welfare in our country is unsustainable, and that we should not, as people who care about other people, allow that path to continue. In spite of the fact that we believe this trajectory is unsustainable, there are some good news. There is some good news out there that I want to share with you. For the last 2 years, the numbers of young people entering foster care across the country has begun to reduce a bit after years of steadily escalating every single year. The overall numbers of children and youth in foster care have also gone down slightly nationally. The trend is not enormous at this point, but at least that upward movement has not progressed over the past couple of years. The numbers of children awaiting adoption nationally has also reduced, thanks in no small measure to the efforts that are going on in Indiana and other places. Still, one of the main reasons is that we should not allow the current path in our child welfare system to continue as it is that 75%, 3/4 of our founded incidences of child abuse and neglect in this country are not from horrific forms of abuse, physical abuse, sexual abuse, exploitation, but strictly due to neglect. And the sad news of that is that probably about 2/3 of those neglect cases are somehow related to poverty. The family's inability to meet the most fundamental needs of their children, their young people. We also know that across the country, we continue to struggle with disparity and disproportionality in our child welfare system, particularly in our foster care system, where we have incredibly disparate proportions of Native American children, African American children, and families represented there. We also know that the trauma of parent-child separation can last a lifetime. And yet, relatively speaking, we do fairly little to help families stay safely together. In too many places around our country, we remove children first, and then we ask questions later. In too many places, our default safety approach is out-of-home placement, despite the fact that we have data and information to know that many, many families that we work with can be kept safely together with the right supports available to them. We're not doing right by families unless we begin asking families what they need, what we can do to mitigate the circumstances, the concerns that brought them to our attention in the first place. We're not doing right by families if we don't truly make reasonable efforts to prevent removal as required by law, and reasonable efforts to help those families reunify if removal is absolutely essential. We're not doing right by families if we don't invest enough effort in finding kinship care providers, relatives that can serve as sources of family support, especially paternal resources, which has traditionally been one of our weakest areas of performance around the country. We know that in Indiana, you put a very high premium on kinship care, but we also know that across our country, kinship providers are struggling during the pandemic. When we fail to offer these critical supports and critical interventions upstream of a family experiencing distress and extreme trauma, we sometimes unintentionally cause more harm to children than whatever the circumstances are that might have led them into our care. We spend across our country money on trying to come up with more evidence-based practices to fix the trauma after it's occurred than we do trying to prevent it from occurring in the first place. I've been in the system, as Terry unfortunately mentioned, for over 4 decades now. And I know that we are a wait and react kind of system, even though we can clearly see events coming forward that will cause trauma to families. We wait until something bad enough happens that we can activate our resources out there and the fundamental supports that so many families need. And I struggle, quite honestly, to make sense out of continuing to do our work in that way when it is achieving such unacceptable results for us. I'm so proud of the experience that David has mentioned of being able to sit down with people, with parents who have lived experience in the child welfare system, with so many hundreds of young people who have lived experience in the foster care system, so that we can understand what those experiences have been like for them, so that we can use those experiences to help shape our policies, our programs, our decisions, indeed our vision of how we can move forward to change those very words that we've just seen coming up in the first round of the chat box there. A while back, we sat down with a group of young adults, as we have in probably close to 40 states now across the country. This one stands out in my mind because we were all sitting in a room gathered around a big, large table, and probably a dozen or so young adults in the room who started to go around the room and introduce themselves to me. Beginning with the first young adult, their introduction was, "This is my name, this is how long I was in foster care, and this is how many placement settings I was in." I was a little bit taken aback that that's how the system had helped them to define so much of what their identity is. We heard, "I've been in foster care for 17 years and 17 placements. I've been in foster care for 12 years and 20 plus placements." We heard, "I've been in every placement type that there is out there over the course of 16, 17, 18 years." The last young adult at the table to introduce herself said she'd been in foster care for 17 years and had 45 different placements. She's not the first one that I've encountered with that kind of a story, unfortunately. As I was recounting that story at a meeting a little while after that, another young adult came up to me and said, "I'm glad that you're shining light on that kind of an experience in foster care, because I was in foster care for 12 years and I had 88 different placements." I want you to think about that with me just for a moment. 12 years. 12 years is about 144 months. If you could imagine that for 12 years of your young life, You had to pack up and move every month and a half on average. Change schools, lose friends, try to make new friends, figure out the new rules, only in time to pack up again and move yet another time. And we expect our young people to be resilient and to live through that. And when they're not resilient, and when the trauma of every one of those moves, every one of those losses begins to manifest itself in behavioral difficulties, mental health difficulties, far too often we begin to blame the young people for blowing out of placements and for having disruptions and for having to move. We have to understand that we're providing those kinds of experiences to so many of our children and our young people in foster care. And every time they have those experiences, it makes it increasingly more difficult for them to make the kinds of attachments that are absolutely necessary for becoming healthy, resilient adults. So I have to ask you, what are we protecting our children from when we offer them those kinds of experiences? As I mentioned earlier, the COVID pandemic has shined light on the effects of so many of our practices in the child welfare system. Emancipating children out of foster care without permanency in their lives is one of the most dramatic situations that this pandemic has brought to our attention. Yet, it's not a new situation, and it wasn't caused by COVID. Every year, we emancipate 20,000 young people out of our foster care system without permanency, without the connections that they need, without the relationships that would sustain them. I know that you believe that children deserve better than that, and that our families deserve better than that. Terry, I love the fact that in your introductory remarks, you talk about the system serving whole families. And that's the direction we must move together in. We believe in the Children's Bureau that we can, in fact, strengthen families. We can reduce unnecessary parent-child separation. We can disentangle this whole relationship between poverty and what we call neglect. We can squarely address disparities. And we can create a system that promotes child and family well-being and family integrity instead of threatening to destroy them. You know, so many of the inequities that we face in our society, poverty, oppression, disproportionate challenges for people of color, disconnected youth, all of those inequities are magnified in our child welfare system. But it doesn't have to be that way. We can change it. We can reimagine a different, a more effective, and a more humane approach to supporting families to keep their children safe. And that's precisely what David and I and others in the Children's Bureau have been doing for the past 3.5 years, carrying the message of a reimagined child welfare system to our country. There are ways to do that, and I want to highlight 2 primary ways that I think we must commit to if we want to fundamentally change the words that came up in the chat box a few minutes ago. The first thing that we have to commit ourselves to doing is to work together to reduce the need for families to ever make contact with the child welfare system in the first place. The Family First Prevention Services Act points us in that direction, but it only addresses part of the need. Our obligation is to go further upstream before a child has suffered trauma and is at imminent risk of entering the foster care system. Primary prevention of child abuse and neglect means getting supports to families before that trauma occurs. And there are places around the country that we visited for these past 3+ years that are doing exactly that. But first, we have to listen to what families are telling us that they need. Far too often, we come in the door with our plan, our model, our prescription of what will fix them. And I think that's not the right order of things to occur. We need to listen to families. We need to ask families, parents, young people, what do you need to stay healthy, to stay strong, to stay together? And then we need to respond to what those voices tell us. Another thing that we can do to help avoid coming into contact with the child welfare system is commit ourselves to creating networks of primary prevention supports in our communities that can help families build and maintain their protective capacities when adversity strikes, and it always will strike. Even if formal services are not there in abundance, which is true in so many areas of our country, including where I spent most of my time working in the field in child welfare. There's not a county out there that doesn't have some combination of a school, churches, doctor's office, a hospital, public health department, Head Start centers, civic organizations that with leadership and vision could become the foundation for a community-based prevention network. We all can play a role in making that happen, whether we are a public agency, a private agency, a member of a community, the court, the legal system, the service provider system. We can play critical roles in putting those primary prevention networks into place. But this requires us to examine our values and how we view the parents, the families who come into contact with our child welfare system. It requires us to value the parent-child relationship as opposed to only valuing the rescue of children, which I believe is how our child welfare system has traditionally operated. We need to give or do more than only protecting children from physical harm. We must protect children from physical harm, no doubt about it, but we also must do more than that if we want healthy, resilient families and children. We must give our families what they need in order to thrive and to break very difficult, painful, intergenerational cycles of disparity, of difficulty, of disruption that accompany the lives of so many of our families. Creating a primary prevention approach to child welfare has to be our commitment. The second thing that I want to highlight that I think we must commit ourselves to is based on the fact that even with strong prevention networks out there, we know we're dealing with humanity here. We know that some families will need more intensive interventions and services. And for those families who must be involved in the child welfare system and whose children must be served in foster care, we need to dramatically change that experience as well. Our current crisis has given us many, many challenges right now in helping the foster care system be supportive of entire families. Because of the pandemic, we have limited visiting between children and parents. We have court closures across the country, even though we have urged courts to use all technological means available to them to stay open and to continue those critical operations. We have lack of services that will enable reunification or permanency achievement. And in the face of all of these challenges that COVID has thrown at us for our foster care system, we think that we have a major opportunity to come out of this crisis better equipped to address those issues. there are a number of things that we can do to change that foster care experience. One of the most fundamental things that David and I have talked about all across the country, and we've even changed our policy in the Children's Bureau to support it, is to ensure that every parent and child in the child welfare system has access to high quality legal representation, even before an initial hearing if possible, so that their needs, their desires are put before the court and advocated for. That is the role of an attorney. And across the country, all parents and all children do not have attorneys to represent them. We can change that foster care experience by beginning to treat foster care as a support to entire families, supporting, helping resource families to work with children's parents to support children, and to show children in foster care that not one parent or not two parents or one set of parents loves them, cares about them, wants the best for them, but that multiple people are working together cooperatively on their behalf for their well-being. Another thing that we can do to change the foster care experience is to normalize the parent-child interactions while the child is in foster care as much as possible, and by never ever using parent-child contact as reward and punishment. We have example after example of how resource families and children's parents have worked together to share parenting responsibilities, how resource parents have been role models, mentors, ongoing sources of support for families, even during their most difficult and challenging times, and even after reunification has occurred. There's no reason we can't reimagine a foster care system where that is the norm, that is the expectation. We can also change that foster care experience when we begin to take legal requirements for reasonable efforts very seriously. Reasonable efforts to reunify children, reasonable efforts to achieve the permanency goal for the child who's in foster care, not to mention reasonable efforts to prevent removal in the first place. When we've sat down with parents primarily across the country and heard their experiences, more times than I want to recognize, what they have told us that we have asked of them has been far from reasonable. Usually along the lines of some version of this story of having to take off work when they can't afford to do that. Poverty probably was one of the reasons that their child came into care. To travel many miles away using multiple forms of public transportation, trying to line up childcare, to get to an hour of counseling that may be canceled when they arrived, or worse yet, that might not even be what they needed to improve their circumstances in the first place. Usually without having their active input into what was needed that could truly support them and help improve their circumstances. Most of those stories don't fall in the category of reasonable as far as I'm concerned, yet we put our families into those circumstances more times than not. We have an incredible opportunity right now to commit to a better child welfare system, one that values families, one that really believes that families can be helped to avoid the difficulties that we spend our days trying to fix, one that's committed to breaking those harmful cycles, one that is focused on preventing bad things from happening to children and parents to the extent that we have the opportunity to do that. This is our vision in the child welfare system. Our vision is creating the conditions for healthy, and thriving families and communities where children are free from harm. To that end, the Children's Bureau has been working in partnership with other national organizations, including Prevent Child Abuse America, Casey Family Programs, and the Annie E. Casey Foundation, along with other federal child and family serving organizations, to launch an effort to take this vision off paper and take it into the field and into implementation. There are 4 sites around the country where over the next few years, we'll be working collaboratively to help those sites implement a true community-based, community-designed, community-implemented system of care that can serve families where they live by providing them fundamental supports collectively as a group before they ever have the need to call a child abuse hotline or face the difficulty of becoming involved with a formal child welfare system. We believe that this is an incredible opportunity. It's a change, a fundamental change. Somebody put the word transformational into the chat box early, a transformation of our system. And we want to be able to demonstrate across our country that this is possible when we work together. This is the kind of change that parents and young people have told us that we need to make. It's the kind of change that we think we owe to all the families we serve, and a change that ultimately can bring hope to our families. I want to thank you again for allowing David and me to be a part of your meeting here. The work that you're doing goes to our heart, and it is our commitment to you to continue doing this work and to supporting you the best that we can. So thank you very much.
Thank you so much, Jerry. You know, I'm listening to you and looking at some of the comments, and I echo them and just say, preach. I'm like, this is church on Friday. Thank you, Jerry, for speaking truth to us. And gosh, I agree. Yes, this is very refreshing and encouraging for those of us that are all working in this together. I was scribbling down all of my thoughts, and so I'm going to try to get a few together because I do have a few questions that I think might be helpful to the attendees here today. One of them is you talked about listening to the voices of those with lived experience, which I love this. And this is something before I left healthcare that we were doing. We were involving patients and family members in our improvement efforts at the table, coming up with solutions. But it was really scary at first. And it was really challenging to get people to see that this could be good. And yes, they may say things that are hard for us to hear, but we can do this. What would you say to encourage people that haven't yet taken that approach to involve, whether it's youth or families or foster families or kinship families, you know, in their actual improvement efforts versus coming up with a solution and handing it to them to ask for their approval? What would you say to that?
Well, I would say ask yourself how you would feel if you were experiencing a difficulty and you went to a medical doctor or a therapist and you were not asked what you needed at all. How would you feel? You'd feel like some of those first words, I think, that came up in the chat, hopeless, helpless, out of control. You know, our families and our young people are no different from us, and we owe them the same respect to have a voice that we want for ourselves in all the other aspects of our lives. But I would also say, be prepared to do something with what you hear. It's not good enough. It'll never be good enough to ask people for input, to ask people to share the most personal parts of their lives, and then not follow through on that. And sometimes that's very difficult. And I can say working in the federal government where nothing is easy to make a change and nothing is fast. We've committed ourselves to taking those words that we've heard, those experiences, and converting them into actions, whether that includes proposed legislation, whether that includes trying for changes in our financing and funding structure. Sometimes very simple things that we can do to modify our policies and our practices. Sometimes it's just words of encouragement to the field to be responsive to those needs. You know, we just finished a series of 12 virtual regional roundtable discussions with young people who either are in foster care or who were in foster care. And we had to commit ourselves before we sat down with those young people to do something with those words. And it was just incredible to me. In every one of those roundtable discussions, at least one young person on the virtual calls asked the question, what are you going to do with what we're telling you? What are you going to do with our experiences here? And I think that burden is squarely on our shoulders to do that.
You know, I think, Terry and Jerry, that frame of lived expertise, even beyond lived experience, we have to go into this process, don't we? Realizing truly these folks are the experts. They've walked in these shoes. I think right now what our organization is doing is a huge commitment to racial equity and inclusion. And it's the voices of our colleagues and families of color that have to be the voices we listen to. They are the experts. They've had that experience. And I think it's interesting, David, I think you were there with us when April Curtis, a longtime national champion for older youth throughout the country, youth aging out of foster care, said, you know what? I go beyond having lived experience. I have lived expertise. And that was certainly an aha moment for me, but I think for all of us, we have to have that sense of respect that indeed they're the experts at this point, much more than we are.
Yes, absolutely. And it also requires humility on our parts. And I think that's missing. Somehow our degrees or our titles obscure that at times. And we start from a place of humility, trying to understand one another as human beings. We're better situated. And that's just been communicated time and time again.
And creating safety for those who are listening as well as those who are speaking. I think just as I'm sure, Terry, you did at Riley Children's Hospital, creating that space that says, this is only so we can do a better job at this calling that we've all, you know, committed ourselves to.
Yeah.
Yeah, I think about that, and there's a question about paradigm shifts. You know, shifting a paradigm, it does take time, and you know, paradigms are simply those beliefs and actions that we take. And so how do we shift those? This is a paradigm shift. I would say for many people in the public, that's pretty comparable to saying that the world is round and not flat. And that sometimes fixing it may not be enough. We have to actually transform it and redesign it, and come up with something entirely different. But it does take time and a lot of patience. And so we have some folks here listening today that would love to hear how you recommend we just stay patient and dedicated to realizing that those paradigm shifts take time, but they're necessary. How do we keep going forward and not give up just because it's taking so long?
Yeah, I might not be the right person to ask because I'm pretty impatient, and we want it all and we want it now. I think we do have to think big. I'm not going to back down too much on that. Fundamental change, fundamental transformation is a time-consuming process. But I think what we have to do, Terry, is sometimes I think we focus on very technical kinds of changes and fixes out there, when what we're really trying to deal with here is, as you've said, a fundamental issue of behavior and values that are at play here. I believe that people will do everything they can to do the right thing if they believe that that's the right thing to do. So messaging and communication and constantly reinforcing a vision and demonstrating how we can begin to bring that vision to life, I think are critical elements to any of the transformation that we want to see out there. We focused, before we were rolling out our Thriving Families, Safer Children initiative, we focused probably a good 2 years just in trying to build consensus among so many of our key partners about what a vision is that we can actually commit ourselves to in an implementation situation. And it was only after we had that kind of an agreement about our commitment to values, our commitment to vision, that we felt like we're ready now to go forward as a collective. Any one of us could have tried to do it individually, it would not have worked, but go forward collectively to bring that vision to life. But visioning, in my experience, going back to when I was a child welfare director, is not just something that we do and we check that off and say, that's done. Visioning is the first, the middle, and the last thing that we always do. Everything has to come back to vision. We can bring our activities back to vision through so many ways, looking at our policies, our programs, our continuous quality improvement efforts are a primary way to link behaviors out in the field, outcomes, experiences, right back to vision. And that helps us, I think, to stay on track and stay the course and focused in the right direction.
And
And I would add that, visioning is a creative process. It's not about disruption for disruption's sake. It's about building something new.
Yeah.
And that in part is fueled by letting go of what's not working, letting go of what's not serving us. And that's a simple thing to do if we're brave enough to do it. We can begin the process by stopping doing what's not working and making space for those activities that will align and animate and propel us to the future state that we're all committed to.
And David, let me add on that sometimes, when something's not working right, we create workarounds. And sometimes those workarounds might seem like a good thing. And we have to be willing to let go of something that may seem good right now because it really isn't in the best interest of achieving that vision. And just one example I have, so if people are wondering, well, what could that be? I think about here in Indiana, we do an amazing job, although we can definitely do better with our older youth. We have extended foster care up to the age of 21. We offer volunteer services up to the age of 23. But what if we weren't having so many kids leave the system without connections to families? What if we didn't need that system in place? Yes, it's wonderful right now because we created a system where we removed children and did a great job of making them feel unwanted by moving them to lots and lots of different places, and then they leave the system. So what can we do to help make those connections early so that one day, potentially, we don't have a need for that? And so I challenge everyone listening to think about things in that way, to think about really what is the best and what will it take to get there.
And I think, Terry, knowing that you, having been a former child welfare director as well, you may need those of us listening, those of us participating in this, the outside voices sometimes to push the envelope, if you will. You'll coach us in what we need to say, but having been there, sometimes there are things, and I'm sure Jerry and David have had that experience as well, that it's easier for your private partners, our educational partners, and that's one of the things that is such a great value about the IU Northwest Child Abuse Prevention Forum. It has always brought such a diverse audience. All of our voices then complement what you're trying to, coach folks to realize on the inside, that it is worth this transformational shift, that it is worth our time, energy, and efforts.
Absolutely. we're all part of the system. You know, we all touch the lives of children and families in different ways. But the more aligned we are, the better the opportunity we have to change.
You know, one of the things I was going to share, and I'm sure many of you all are aware of it, but the Prevent Child Abuse America Network, which it's gonna be an amazing partner for you all in the Wellbeing Initiative. Dr. Melissa Merrick is just like both of you. She wants change and she wants it now. And so we are all very excited. In fact, I think we'd all put a plug in, put Indiana in that next tier, right, Terry? Are we ready for that?
Yes, please.
Great.
But it's a messaging around what if we became mandated supporters instead of mandated reporters. And I just love that. It's a total reframing. How can we support children, youth, and families in our communities so that they don't experience that trauma that then we have to figure out how to mitigate? So I would put that out there as a call to action for all of us. What can we do to support rather than report as you're rolling out this well-being initiative?
Absolutely. I love that.
Do I have time to talk a little bit about COVID? I think I do. I don't hear the music and I don't see the hook coming, so I'm going to go ahead and
time.
Okay, good. I'll keep going. Thank you, Jerry, for talking about the pandemic and what we're all dealing with, and it's a challenge as a child welfare leader making those decisions to make sure that we are holistically looking at how to best serve families. And so I just wonder, and not just for me, but for everyone listening, as we think about virtual services, and we know that virtual services were very helpful during the pandemic. In fact, we were all grateful that this pandemic didn't hit in the 80s, right? Because we had access to the technology. And so we were grateful for that. And as a state, we look at how do we best continue to serve families and try to keep people healthy at the same time so people can continue working with families and families can get these supports that they need. Do you mind talking through a little bit what your thoughts have been during this pandemic and trying to answer questions when we really didn't have answers necessarily? CDC was still learning, healthcare providers were still learning. There were a lot of moving parts. As we move forward cautiously, how can we make sure that we are still putting the families first holistically, physical health, mental health, and the physical and mental health of those of us that are serving them?
Yeah. Well, when it comes to COVID, I'm going to be very, very transparent here. It caught us off guard. There were, so many things that were happening out there that we just had to find out about. We should have anticipated. The issue that when colleges and universities started closing and their dining halls started closing, that so many of our young people would become homeless because they didn't have the families to go back to and were dependent upon dorms. They were left, many of them, without adequate food because of the dining halls. As soon as we became aware of that, we reacted to it. And I think in a very, very positive way, and states began reacting to that in a very, very positive way. As far as we know, we couldn't have prevented that necessarily from happening, but I think what we can do, and that's just one example. There's other examples. We should have anticipated that across the country the courts had closed down, and that some of those did not have the technology to be able to move forward. I think these are things that we inherently knew were already out there in our system. We knew that so many community-based organizations that are the face of services to our children and families struggle to get by financially in normal times, and in the face of a pandemic, we're struggling just to stay afloat, and many of whom will not or did not stay afloat. I think going forward is that we can't just make an assumption that whenever this pandemic is under control and life goes back to whatever we want to call normal again, that we'll just continue operating the same way that we did. We have to use this knowledge that we have right now, not only to prepare for another disaster, but to fundamentally change how we serve children and families out there. If we had the kinds of community-based supports out there and we were funding them and giving them the support that they needed, if we were able to use federal funding to pay for things other than foster care or adoption, like concrete supports for families that were out there, if we were committed to no young person aging out of our foster care system without the permanency of a strong relationship or a family, if we're committed to those kinds of things going forward, our child welfare system would look radically different than it does right now.
You know, and we knew prior to the pandemic that the need for child welfare existed in the space where poverty, public health, and civil rights collide. And if that's not completely visible to all now, there's some trips to the eye doctor. But it revealed, you know, some really hard and frankly some ugly truths about our system that we've spoken quite plainly about. And as an example of that, you don't need to look much further than a lot of the media coverage that's occurred across the country, where there's a narrative that because children are exposed less to mandatory reporters, that will absolutely result in parents harming children more often. And I feel like that is a real value check moment. You know, what is that saying about our perceptions of poor families and families of color? And it's a narrative that's been very hard to disrupt and challenge. There are dangerous conclusions being leapt to, and frankly, we have no data at this point to support those assumptions. So we're trying to challenge that as strongly as we can and say, you know, maybe we're focusing on the wrong things here. Maybe the story we need to tell is that this is a moment in our country where families need a lot of support. All families do. And maybe we ought to be mobilizing and organizing around that instead of predicting bad things. And, you know, we've got just tremendous examples that Jerry has mentioned around the country of communities that have realized that and are rallying around families. We've got anecdotal data about reports to hotlines going down for abuse and neglect, but corresponding increases in reports to warm lines and helplines and people reaching out to get concrete needs met. And at risk of going on a bit too long here, I'll just add further that, you know, if we look closely enough at the data that we do have and the trends that many jurisdictions see over time, you know, an awful lot of calls come into hotlines for issues that ultimately are screened out. Poverty issues, a lot of calls for educational neglect, that ultimately are not substantiated. And so I think we have to be really thoughtful about what we're learning right now and not leap to conclusions and challenge those that are, because there are some real underlying biases there that are driving certain ways of talking about what's happening.
And even that reality of connectedness, I think one of the other things that shined a light on was the digital divide that continues to exist, those in poverty, families of color, our rural areas. And we're fortunate in Indiana to have a governor who got that pretty quickly, didn't he, Terry? And so that's been a commitment, but I know we've had kinship caregivers that weren't able to arrange for childcare, or their car wasn't reliable to get to our monthly and bi-monthly support groups, who now are able to participate every single time and just talk about the affirmation that gives them, that they're not the only person missing, you know, bingo at the church and their church circle to raise, you know, the children and keep them in their family circle. So I think that teeter-totter of valuing, you know, we know even the virtual connections aren't a replacement for face-to-face, but boy, can they augment that connectedness that Dr. Brene Brown talked about.
Yeah, so I think we may have time for one more question, and so I'd like to get this question, and I believe this is for Jerry or David. So how are you involving the CBCAP leads in all states to really start this transformation versus waiting a couple of years to see what would be learned from pilot states?
I'll toss that to David because I know he's eager to answer that.
Well, the CBCAP grantees and the work that, frankly, many of them have been deeply engaged with for years is a main source of, one of the main sources of information we have about what community-based support looks like. And they've been a key partner at every stage of our development of the vision. They've been an outstanding group to keep us honest. As Jerry mentioned, we are really invested and have made various efforts through our budgetary process to try to increase the funding for that group of grantees. But we see them as central. The little bit of discretionary money that we have, we've tried to elevate opportunities to bring CBCAP together with the Child Welfare Agency, with the legal judicial community, with the wider prevention community, to be a part of crafting state 5-year plans, to be a part of crafting PIPs, et cetera. And we just couldn't possibly articulate how important that work is to realizing this vision.
And not only is it the CBCAP leads that, particularly in our Thriving Family Safer Children initiative, we have asked those sites to make sure that other prevention partners are a part of that as well. Children's trust funds, the PCAA chapters in those states, and some other active players there. But that was a chief component in deciding where we would try to implement this whole work.
And I can add on for Indiana, even though Indiana isn't one of the states in the tier 1, that does not mean that we don't get started.
Yes, exactly.
So just to encourage everyone out there, I say a lot, when I reach out, please say yes, find a way to say yes. Because we have lots of work to do and we do not need to wait. So that when we do get chosen as tier 2, hint, hint, we are in a better position, right, to keep going forward.
With a cadre in the community of community partners, prevent child abuse, prevention councils that cover equally 2/3 of our state, our leadership in home visiting, Healthy Families America, Nurse Family Partnerships, parents as teachers. So we're all over it, right, Terry?
Yes.
I think you are. Yeah, that's great.
And, you know, I want to be sure to emphasize, and we need to improve our messaging on this, but the Thriving Families Initiative in all 3 tiers are really designed to create very inclusive learning communities. So it's not a sit around and wait for results effort. It's an iterative, ongoing, inclusive national learning opportunity. And there'll be different ways for everyone to be involved as this continues to grow and evolve.
Well, I am re-energized. I'm a child welfare professional. I have enjoyed this tremendously. I really appreciate Jerry and David sharing this information with us today. This has been insightful and engaging. The conversation between you guys and Sharon and Terry has just really sparked some really great conversation, along with some comments that we had in the chat box. So thank you to all of you. Clearly, this is a time of change that will require all of us to work together. And so I really look forward to what the future holds. I look forward to this type of gathering again of all of these great minds. And we appreciate you guys for just taking the time this morning to serve as part of the Child Abuse Forum today.
Thank you for letting us.
Thank you.
Absolutely. You're quite welcome. Thank you guys. Have a great day. We will now listen to Julie Villarreal. I'll turn it over to her and she'll be introducing our next speaker.
Thank you, Marshila. Good morning. My name is Julie Villarreal. I'm the Regional Director for the Villages Northwest Indiana office. I'm also a member of the IUN Forum Planning Committee. So today I have the pleasure of introducing to you the final keynote for today. Monica was employed as a police officer with the Detroit Police Department in 2004 and assigned as a task force officer to the Bureau of Alcohol, Tobacco, and Firearms in October of 2007. In 2013, she was assigned to the Chief's Neighborhood Police Bureau and retired in May 2014. Her police duties included enforcement, prevention, and intervention. She served as a subcommittee chair and creator of Operation Safe Passage, Alternatives to Exclusionary Discipline, implemented into Detroit's Youth Violence Prevention Initiative under the direction of the Department of Justice in 2010. Prior to her appointment to the Detroit Police Department, she was a teacher, pre-K through high school, from 1992 to 2004. She's currently a consultant trainer and provides life coaching. Additionally, she's a consultant coach and instructor for International Institute for Restorative Practices and serves as a day reporting manager at Campania. In her personal life, her family is only second to God. Her husband and her serve as volunteer youth pastors together, serving children 0 to 18 years of age. They've been married for 28 years and have raised 9 children. The last of their children turned 18 and they are grandparents as well. So without further ado, I'd like to introduce you to Monica Evans.
Thank you, Julie. I realize that some of those things have changed since I gave you my bio. So I'll go ahead and address some of those. I'm no longer with Campania, but I still am consulting. I'm still a parent of a 18-year-old, almost 19-year-old, and been married 28 years, still doing all that, hopefully, going on 29. You know, it's been a blessing to be retired and to be a consultant and a coach and everything. But I would say the greatest thing that I really enjoy is working directly with young people and youth, and also working with the community. I love doing trainings and stuff, but I also really, really enjoy working directly with young people. And I think it also said that my husband and I serve as youth pastors. We served as youth pastors for 7 years in Michigan. So those were just some things that I just wanted to get so folks don't fact check me and think I'm a liar. So, but right now during COVID, I've had the privilege of doing a lot of some virtual trainings for the state of Indiana, which has been a blessing. And hopefully some of you that are in here have been able to attend those, really to deal with situational crisis. And I'll be doing that in next week's training. But today, you know, we're going to really address a lot of what trauma is, and specifically adverse childhood experiences and how that impacts our lives. And looking at a restorative approach. I love the word restorative, and I've been doing restorative work since 2009 now. And I love that word restore because it means to make something new again. And I think that's super important, is being able to make something new again. I love HGTV, and I love watching the old becoming new. And when we look at trauma, a lot of times we can feel a lot of sympathy And we're gonna talk about sympathy versus empathy, and then how do we work with it. I love how Mr. Milner and Mr. Kelly addressed the conversations that they had with young people or young adults that had experienced trauma and multiple foster homes. And so I'm gonna share a little bit of my story as I go on to talk to you about adverse childhood experiences and its personal impact on my life, as well as how I've been able to take some of those tragedies and those traumas and create a great testimony, but not being able to do it by myself, but with many others. So when we look at partnerships, and I got to move my little screen out of here, and the essential partnerships. And as I was listening to our speakers before, and that community-based support, that's what I've always seen. I've always seen the value in community. That's why I am who I am today. And so when I look at essential partnerships, it says we need community and youth to understand leadership, and we need to understand them. The leader's job is to give direction, vision, and encouragement. Regardless of how good we are, we will be ineffective without the community support. Our success will be determined by the quality of citizens we engage and produce. Discerning the quality and ability of people and directing them appropriately is imperative to healing society and building a new enterprise. And I use the word new enterprise because when I look at people, I look at each human being as well as myself as something that is a great contribution. And when we look at investments and how we contribute and how we invest, is that we create this community that allows for everybody to have a buy-in and a part of what that is going to look like. And when I think about good investments, you get a great return on those investments. And so when I look at enterprise or the ability to make something great, that's why I think that it takes a whole community and every gift of every human being and all the intrinsic value that we all bring to the table to make a great community. And so when we look at adverse childhood experiences, a lot of times the expectation is that, you know, it's going to be really challenging and hard to come out of. And yes, it will be. And adverse childhood experiences are very common, but not commonly recognized. I would even say for myself, growing up, I meet all 10 of the ACEs score. So does my husband. And most people did not even recognize that I had any kind of trauma. And we'll talk about that in a little while. So we look at ACEs are good predictors of later social functioning, well-being, health risks, disease, and death. Adverse childhood experiences are interrelated, not solitary. So one without the other doesn't mean that all 10 of mine ACE scores may have been impact me in the same way that they may have impacted somebody else. This combination makes adverse childhood experiences the leading cause of health, social, and economic issues in our nation, such as was addressed earlier in the sense of what poverty looks like and how poverty can impact. I always say that poverty quite often is the symptom and not the cause of more traumatic or trauma events. And I'll talk about that a little bit more as well. And I know that Julie is going to moderate any questions. I want to address that. And we are going to leave time at the end to answer your questions as well. And hopefully everybody can hear me well. So when we look at childhood experiences, we look at these experiences and how they impact us and why they say they're so related to early death. So we have the adverse childhood experiences, and then that disrupts neurodevelopment. And then we have the social, emotional, cognitive impairment, which leads to disease, disability, and social problems, and then early death. And I'm going to take a look real quick at the chat just to make sure that I'm not missing anything. Okay, good. Sound is great. Awesome. I just want to make sure. So when I think about the things that myself or my husband might have gone through, my husband it's sort of like that person, the kids that Mr. Kelly and Mr. Milner were discussing, that he grew up in 15 different foster homes. And between the age of 5 and 13, and then finally a grandmother, that kinship was able to step in and care for him from 13 until 18. And that was impactful. And so when we look at, you know, that abandonment or that loss or never being able to make connections, maintaining a almost 29-year marriage is truly a miracle. And so when we look at these disruptions in neurodevelopment, I would say my trauma really impacted my academic learning as well as my speech. So I had a lisp and a stutter. I also had some social issues in the sense of being able to complete kindergarten on time, and had to do kindergarten twice, and some other things. And so it was very difficult in the sense of how to learn or how to read or how to grow or how to mature the way that I was supposed to. But I loved, in reality, I loved playing and living in a fantasy world, which was really cool. And then we look at the adoption of health risks and behaviors, and disease and disability and social problems, and then again, the early death. And I can tell you that in my family, each one of my siblings have experienced different things with regard to our childhood trauma. And they encompass this whole plethora of things. I would say my oldest sister experienced early death, and she had become a heroin addict and a prostitute, and was murdered by a serial killer in 1989. And I have a brother that's in prison. And so each one of these things, again, impacted us on a different level, each child, each sibling in our household. That's my change. There we go. So adverse childhood experiences are one of the most basic and long-lasting causes of health risk behaviors, mental illness, social malfunction, disease, disability, and death, as I talked about before. And this is nothing new to you. Most of you guys are caregivers, social workers, mental health professionals, and you know this. And so I'm speaking to you from experience and how these things are impactful, but where are the interruptions and where are the preventions that we can have? And this is just really to help understand the core concept. Often we do this work every day and we get desensitized. Like Julie was saying that I retired from the Detroit Police Department. I've seen a lot of horrific things that most humans do not experience at all every single day. And I would say, I don't think that 1 week went by that I didn't experience the death or the hurt or the abuse or the sexual abuse of children. And so those things can weigh on you as well. So you take a person like me that's experienced trauma as a child, and then you put them in a very traumatic kind of setting, and those things can actually contribute to further harm often. And then when we look at how we deal with these things, you know, we have the different kinds of abuses and how one sort of gets into the system. For me, I never got into the system. My household and my mother was really good at masking all the things that went on our household. We didn't know to tell about certain things, and we didn't even know that what we were experiencing was harm until after we began to see the causalities manifest. So when we look at the psychological and parents, the physical by parents, and the sexual, and what I realized as a child, my mother had very strong bouts of depression, and they were up and down. And then, you know, when we look at how a parent deals with that, you know, it can be physical. So, you know, my mother didn't have a problem with laying hands on us, and it wasn't the kind of laying hands that you get out in church, okay? And then sexual abuse. And so I would say that my sisters and I experienced sexual abuse for a very extensive time, because my mother just had a hard time picking the right men to come into our household, and then different kinds of caregivers because of poverty and not being able to afford appropriate daycare, those different kinds of things. And so then, you know, you can get down to the emotional and just the physical kind of things, and you can see the just different numbers of how they impact household dysfunction by category, and that's alcoholism or drug use in your home. And I would say that's not something that I experienced in the sense of my parents as far as alcoholism or drug use. But again, then I had siblings that responded in that way to help deal with the traumas that we experience, the loss of a biological parent. And that could be through divorce, that can be through death. And mine was through divorce. And that happened when I was age 6. And it was extremely difficult because you have a 2-parent household. And I honestly had a very loving father, very meek. And so he just didn't know how to, what I say, have some testicle fortitude. Some people may understand that and may not understand that, but he lacked a little bit of testicle fortitude when it came to assertiveness. And so my mom chose a guy from prison and felt like she needed somebody with a little bit more authority. And that was where hell began for our lives. And so he was an alcoholic, and your loving dad is gone and you get this other guy in. And so then my mom gets into depressive state. We used to have to deal with, I think, twice her trying to commit suicide because of domestic abuse. He used to beat the crap out of us. And then imprisonment. My oldest brother just was released after 30 years of prison for double homicide. And so these are things, when I think about all these categories, you know, that one fits into, I fit into all of them. And it's interesting. How does one come out? How does one come out of this? And we're going to talk about that. So when we look at an ACE score, an impaired memory of childhood, it depends on where you're at. Some of these memories will come back. And the interesting thing is that as a child, you don't know what you don't know. As an adolescent, I began to learn these behaviors, and these learned behaviors became my norm. And so in high school, towards my later years of high school, I was highly promiscuous because it was learned behavior. I didn't realize it was learned behavior. A caveat is I was also raised in a Christian home. And most people are like, what? Like, how many of you guys just gasped right now? But yes, I was raised in a Christian home with a mother that proclaimed Christ as her personal savior, a father that did too. I watched my mother always on her knees in prayer. But a lot of people would say, well, that's quite hypocritical. I think that a lot of times we don't get to a point where we fully know who we are and what we've been created for. And so then we sort of mask in all of these different things, and we don't know how to come out of these things. And so then it's transferred onto your children. And that's what I believe that my siblings and I experienced is an unintentional transfer of harm. And I don't think any parent, like, you know, our speakers before were saying, intend to harm their children. It's not their intent. And so what I can say that my parents did well was put us in church. And so when I look at interrupters and these memories of childhood, and whether or not they're impaired or not, is that there's different times in life where different memories that I've tried to suppress have come to light. So when we look at memories and we look at triggers, and triggers are super important to understand and why a child responds. And you're like, I didn't even do nothing, or I don't know why they're responding this way. It may be that a memory was just triggered, a harm was just triggered, and you're seeing something that maybe it had never occurred before. I can tell you this, that my sister moved into the community, the same townhomes that we were raised in. And when I walked into the house, I felt an overwhelming feeling, and smells and everything came back. And I walked towards the basement where a lot of bad things had occurred, and I had to walk out. And this was 40 years after all of these things had happened to me. And from smells to sights to everything that was harmful overwhelmed me. And I just broke out in tears, and I went outside, and I had to gather myself, and I had to say, no, you're better than this. I can do this, and walk back in to take authority over that pain and that hurt. But something just recently, in the sense of impaired memory in my childhood, is that the wearing of a mask brought back such a harm, because one of my violators put his hand over my mouth to keep me from yelling or making noise in a very violating it. And so when I put the mask on, it triggered a sense of like major anxiety, like I almost had a fit. And I had not wore a mask before, in the sense of the doctor's kinds of masks that go across. And so it felt like a hand covering my face, and I couldn't do it. And so this time of us having to wear a mask has been very, very, very difficult for me. And I've had to find different ones that don't feel like a hand over my face. And so even something that simple that's meant to keep me from harm or to keep others from harm has been extremely harmful for me, and memories of my childhood, and bringing back those things that we think that we're healed from, and maybe not so much. And I'm not going to go in, because I know that you guys know data. That's what we do as caregivers and providers. And we look at just the harm and the demographics. And these are just some statistics. And I'm not going to go deep into them, because we just don't have a lot of time. So I want to leave time for questions for you all. But these are some of the impacts that impact age groups, you know, our race and ethnicity, and, you know, whether or not we're going to get an education and what that's going to look like. For years and years and years, I had a hard time with math and refused to go back to college. I tried to go to college several times and kept failing my math classes. So therefore they don't let you continue on. And I was like, I don't know why colleges don't let you take the classes you want. I don't, you know, and it is what it is. But eventually, just recently, in February of this year, I graduated with my bachelor's in forensic psychology. And it took years for me to be able to get past the sense of shame of learning, of feeling those learning blocks. And I kept telling people, I don't need a degree. You know, I've really been blessed. I have a great husband. He's a great provider. And really, that was just really to overcome to look at that shame that says, I can't learn. I have this mental block, this cognitive learning development. And I would tell you that when I've taken IQ tests, they have been very, very low. But I would tell you that my emotional intelligence tests have been very, very high. And so I've had to come to an understanding of what I can learn and what I can't learn, and then what I'm really good at, and sort of combining them, and then trying to get the help that's necessary. And so let me tell you, I used every tool necessary to graduate as magna cum laude this year, because I didn't want to fail. I didn't want to let my family down. And I had to overcome that sense of shame of learning. And that's what a lot of our kids feel in school. You know, we see a lot of aggressive behavior that comes out of our kids that have trauma. It's really not that they want to be mean or that they want to be hurtful. It's the shame that says, I can't learn the way that other kids learn. My way of dealing with that in school was being the goody two shoes. I have always been a tattletale. I will always be a tattletale. I am the snitch of all snitches. I told on my sisters, I told on everybody. So I was the classroom pet, and I didn't do it in a way where the teacher would say, oh, stop telling. I would say, teacher, you wouldn't want us to do A, B, C, and D. So I was pretty good at manipulating too. That's learned behavior as well. So I always said the gift that I got sometimes is the ability to sell sand on the beach. And so that was the kind of behavior I was. I was a really, really good kid. And that helped me in the sense of getting out of some stuff. And that's, again, didn't help me at all academically, because I still graduated from high school cum laude, fifth in my class. Because I had a lot of favoritism, and I put that in quotes, a lot of favoritism. And so again, we look at some of the causalities that come out of that: alcoholism, drug abuse, you know, and IV drug use, and such as my sister being a heroin addict. And each one of my siblings deal with different things, and they don't mind me saying we've all, like I said, I was promiscuous. My sister, youngest sister, just could not control eating, and my oldest sister has a difficulty in maintaining organization and collecting lots of things in her home. And there's a show that really sort of relates her life, and it's called Hoarding. So each one of us have dealt with all of our trauma in many different ways, and gratefully, not all of us became addicted. Not all of us became alcoholics, but we each have some stronghold in our life that prevents us from being the fullness without great interrupters in our lives, and people that have held us accountable. And we're going to talk about importance of having control and support, like accountability and support as well. I was going to show this video, but it's very difficult because I'm not in control of all the outcomes. So I'd like you guys on your own time to look at a YouTube video, and it's called Through Our Eyes, Violence and Trauma. And it's a couple minutes long, but it's the stories behind kids like me and what they feel and how they feel trauma has impacted them and sort of their stories. And it's really good. And some of you guys may have already seen them if you've taken any of my other workshops. And so when we look at the brain, I love brain science. I don't know any of you do. I wish I could see your faces or see you raise your hand, but this is something that I've really dove into even prior to, I chose forensic psychology because the brain interests me. Why people, so answering that question, we always say, well, why did you do that? For me, I like finding the why. And being able to have the answer. So I like trying to really understanding brain science and what happens in the brain when trauma occurs and how that cognitive delay in development occurs. A lot of schools now are doing social emotional learning and looking at that because they understand that when kids experience trauma, the earlier onset of trauma, the more extended trauma, the more the brain changes. And so you're looking at two brains. One is a healthy brain and the other side is an abused brain or a neglected brain. And you can see literally where portions are missing. And a lot of times when we look at that fight, flight, or freeze that was given to us to help protect us, quite often is that when we've experienced trauma, there is an overproduction of chemicals that is breaking down our logical ability to think. And so I don't have a lot of time. I do a whole 2-day course on this, and the first day is just really committed to looking at the science. What are the chemicals that are doing it? When we look at cortisol and adrenaline and the serotonins and how they break down the frontal lobe of the brain, and there's an overproduction in the of chemicals through the amygdala, which is our emotional responses, and we tend to deal more emotionally than logically because in trauma you're constantly trying to protect yourself, and it may not even be a protection you need, but you believe you need it because our perspective has changed in the way that we see things. And it may be different than the way another person sees things. So we look at, I love criminologists, and it's not because I was a police officer. I liked them before, even when I was a teacher. And so there's this guy named Tom Tyler, and he's a criminologist, and he asked the question, why do people do the right thing most of the time? And I know today a lot of people would say, well, that's not a true statement. Most people don't do the right time. But really it is. It's always the minority that disrupts the majority. So it's a minority of people that disrupts the majority. It just looks overwhelming. So Tom Tyler says people obey because they believe that it is a proper thing to do. And I got to move my screen again. So they react to evaluating their justice of their experiences, and they consider the factors unrelated to the outcomes, such as whether they have had a chance to state their case, been treated with dignity and respect. And so that comes from the book from Tom Tyler, Why People Obey the Law. So I'm going to give you guys a few minutes to, like a couple seconds. What are your thoughts on the idea that justice is measured not so much in achievement, but the outcome? What does that to use to achieve this outcome? What does Tyler's finding have to do with your style of disciplining when you think about accountability for our constituents. So what are the thoughts on the idea that justice is measured not so much in terms of the outcome or the punishment, but in terms of processes used to achieve these outcomes? What does Tyler's findings have to do with your style of disciplining? And I use that word in a sense of accountability when we want to work with young people that may have aggression or that may have behavioral problems, or even families that are struggling really hard, and parents that may have aggressive behavior towards their children. So just think about that. And then maybe just put your answers in the chat box. And I can't see them, but I'd like each one of you all to see them, to be able to address that. So when we look at processes and outcomes, and that's why I loved the message before I came on. I was thinking, oh man, that lines up so much with what I'm going to talk about, because we often look at the outcomes and we say, man, are we doing this right? How can we do better? So Tom Tyler and others, like I got this from the sense of a leadership background, and I love leadership books. I love reading leadership. And so we have W. Chan Kim and Renee Morborn, their Harvard Business Review. And this comes from that. And they look at process and outcomes. And remember, I said I like to see individuals as investments and what we pour out. So that's why I love combining leadership principles with how do we heal trauma and intervention and look at prevention. So what is more important, the process or the outcomes? When would you accept an outcome from someone in authority when you did not like the outcome? So a fair process idea is that individuals are most likely to trust and cooperate freely with systems, whether they themselves win or lose by those systems when fair process is observed. And that goes to those connections when you're asking people that have experienced these things how they feel. One of the things that we do in restorative practices, and it's called family group conferencing. And family group conferencing allows for the whole family and anybody that they want that are support systems, whether it's their church, whether it's a neighbor, whether it's a teacher, to be a part of the tools. And we have this conversation. And one of the questions that we ask restoratively is, what do you think needs to happen to make things right? And then the next question is, what can you do to make things right? And then the next question is, what supports do you need for you to be able to do and make these things right for your family? And each person that's a part of that family, if they can talk, have a contribution to building and making their families really strong. And that's how I look at fair process, you know, and being able to include everybody in that conversation. And a lot of states and their departments of children's services have used that family group conferencing model. And that's what I do now, is I coach a lot of families, and we've raised a lot of kids. My husband and I have 4 children. We have 1 adopted, 3 biological, and then we have taken in 5 kids prior, but just recently in the last few months during COVID, we took in 3 more children on a just a temporary basis, just to help reacclimate them, because their families were struggling with behaviors and things like that during COVID, and just really didn't know how to manage those behaviors. Unfortunately, 2 of the young ladies ended up in foster care, but 1 was just recently reconciled back to her family a few weeks ago after being with us about a month and a half. And so that's the goal when we look at family group conferencing, is keeping families together and giving them the tools, but also looking at the things that they already do well. And a lot of times when we look at trauma and our pain and stuff, we look like we have to do things to them. And I loved how Ms. Stigdon said, is that we want to do things with. And that's actually the premise of restorative practices, that we do things with people, not to them or for them, or not at all, you know. And so we look at discipline and accountability often where we want to just do things to people or for people because we feel so sorry for them and that they can't do this for themselves. And so we need to do it for them. And so we have to look at that. We're going to look at what that social discipline window will look like in a little while. And so when we look at fair processes, we look at our humanity. And this is Sylvan Tompkins' idea of, okay, our humanity and my trauma makes me feel shame. And we looked at all those words that came out. We've unloved, unwanted, alone, humiliated. And so Donald Nathanson and Sylvan Tompkins, who are forensic psychologists, came up with these thoughts of shame. And I'm going to address shame in the sense of a disruption in emotional well-being. So shame not as in shame on you, but shame in the sense that I've had a disruption in my emotional well-being, and it's been continued. And so we have these 9 affects of shame. And the positive affect is an enjoyment and joy in our interest and excitement. And so that's where we woke up this morning. We were super excited about coming to this conference and all that we're going to learn, and you're interested in excitement, and then how we came away empowered from this morning's discussion to, you know, sometimes we get neutral. It's a long day. You might be sitting down, your kids are making noise in the background to surprise and startle. So all these different things that it can disrupt emotional well-being. These things happen in our homes. This is the traumatic event of, okay, the divorce, surprise and startle. Oh my gosh, I never heard my parents fight. Why would they be separating? I don't understand. As a child, to that shame and humiliation, my sisters and I, we believed that we were the cause. And I remember having the conversation around the table saying, I promise we'll be good. We won't do it anymore. You know, to that distress and anguish and that fear and terror. And then all these things come out. Now, a lot of people deal with those through anger and rage and dismell. And dismell is not like a real word. It's that stench in your nostrils, like you can't stand people. And we've seen young people there. I had a person ask me a question: what gets into a person that can do a drive-by shooting at a house, kill a 9-month-old baby, and not have any regard for the life, knowing that there were children there, and no regard for life? So that gets down to that anger and rage and that dismell, that stench in their nostrils for humanity, because nobody cared for them. That enjoyment and joy when they came out as a baby, and the interest and excitement was probably there, but then through neglect and abandonment and all these different things, they get to that shame, humiliation. Nobody loves me, so why should I love anybody else? And that child, when I did the interview of that young man, which is a real story, 17-year-old male, and he says, that baby is better off. Their mother knew that they were in a dope house. She knew that that was a gang home. So that baby's better off. He looked at the mother as worthless, and the child is better off being dead. And so that's where he had got that to smell. And that's where we see pain, when it's pain upon pain, and there's nothing to bring us back up to positive. And those, so I say those are interrupters. Interrupters have to come in to bring us back. If we stay down, if our ability to never rise to enjoyment and joy or interest and excitement, to surprise and startle, we will always, that shame and humiliation and those shame labels that we put on will continue to distress us. And we will always see that we have to fight. We got to fight. We got to fight. We got to fight, because we feel like there's nobody fighting for us, and that anybody that comes into our world wants to cause us harm. And so that's where we see a lot of negative behaviors that come out of this, and then it perpetuates throughout society and families. So this gets to how we create a safe community. How do we create these things? And then when we look at our school systems and our teachers and what they are challenged with, this social discipline window is great. And this was created by Blood and Thornsborn, another group of folks that have great leadership structure things. And in restorative practices, we use this because it's great to help all people, whether you're a parent, whether you're a couple, whether you're somebody's boss, no matter what, in what situation, we can all look at these structural contexts and think, how can we work best with people? So we look at the far top left corner of the social discipline window, and it says doing things too, which becomes very punitive and authoritarian. We stigmatize and we blame. That's high control. But also in high control, you see to the left, it says there's structures and boundaries. So is high control always bad? No, it's not. But we're going to talk about how we get it so that it's not so bad. But then we have low structure boundaries. That's doing nothing, becoming neglectful, ignoring, or turning a blind eye. We see this all the time, where, well, it's not my kid. It's not, I've seen teachers say, well, I get my check every week. If they don't want to learn, then, oh, well, we can even get social workers desensitized. They say, I'm just going to do what I can and not do anymore, because we get so desensitized to the same cycle over and over again. And then we get to that doing permissive, rescuing, excusing, and reasoning away the behaviors. And so I can say all day long, okay, I had a learned behavior of promiscuity. Now, do I get to blame my mom for the rest of my life about the consequences of that? Because the consequences of that promiscuity, I had to own. Nobody owned the consequences. And it resulted in me having to have a full hysterectomy at age 28 after bearing 2 biological children. And the third biological children is my husband's from a previous relationship, so he is still biological. And therefore, I own those. I don't get to say, well, look at what happened to me, Ma, you made these bad choices, and Dad, you didn't step in like you could have. And, it's your fault, and I blame. And then they don't hold those consequences of that behavior, despite the fact that that behavior was learned. And so we don't want to be permissive. We don't want to rescue people. Don't want to excuse or reason away the behavior, because that behavior impacts themselves. And so I always ask the question, how has what you've done impacted you and others around you? Because it's super important for us to reflect on that, and then how we can make things right. So doing the with restorative, the cooperative, and collaborative is pulling out the gifts of that young person and really focusing on those things, and then providing them the tools to be successful. And that goes with our families. Pull out what they do well and acknowledge the things that they do well. And that allows for the burden of shame to be lifted, because they still know that they do things really well. And I always repeat back, I always say, so I hear that you have a gift in communication, or I hear that you're really good at art, or I hear. And so when I'm listening to them, I repeat back to the things that I believe are the strengths that those families have, despite of what they've gone through, despite of things that are bad, despite the poverty. And I find the things that have brought them to a resiliency, and then how can we utilize those things to bring them out of poverty and help them provide the tools to be successful, whether it's going to be a better education or a skilled trade or a circle around them that's going to help with childcare and connecting them maybe to a faith-based organization or a church in their community that can be helpful. Find them the tools that they need by listening, but accountability as well as saying, hey, we're here to help you. We want to be consistent in your life, and we want to work with you. So tell us what you need and how can we get you to that, and just being consistent. And that's how I look at accountability, is consistent mentorship, discipleship, however you want to look at it. That's that with box. That's what I see as a restorative way of working with families and keeping them strong and keeping them together. And so when we look at that and how it impacts how we learn, we have to look at how our social identity comes into play. And we see that today. And a lot of times we forget that how we grow up is our perception of life. And our perception is pretty much 99.9% of our reality. You can't tell me that it's not true, because I'm experiencing it. So when we look at the social identity, adolescents undergo changes in how they perceive experiences, themselves and others, including themselves as members of a broader community, with ethnic and cultural, socioeconomic, political, and other factors to their identity. Their ability to function on their own, relationships with family, peers, community, and themselves as emerging adults, including as persons with sexual identities and interests. So it is, the same. In their minds, they believe that to be true. For me, everything, all my socioeconomic. I grew up in poverty, but because my mother always, my mother was a speaker of life, and she would always say that you're created for great things, that you were the head and not the tail. She gave us all these Bible verses, and though she did not figure out how to do them for herself, she poured it into us every single day, that you are a child of the Most High King. And so we began to walk that out. So those words, I think it was Mr. Kelly that was talking about these words of how do we change the mindset, and that she spoke these things, whether they were true at the moment, it created a different identity. And my sisters and I, the three that were in her home, because there's a lot of us that are in different, that there's a lot of kids from different marriages. And so the three girls that were in her home that she really got to pour into in that word. And then she made sure that we were in strong churches. If she was too depressed to take us, she made us sure we was on that church bus. And I think that those are those community supports that need to be there. Things that gave us an external experience outside of what was going on in our home. If we never take young people out of that environment and give them a different experience, it just only strengthens their thought about who they are. Recently, I've been able to work with Lake County Juvenile Probation, and Mr. Elkins has a great program that he's been allowing the kids to do go fishing and do florist and growing gardens and stuff, and getting these experiences outside of their communities. And he wanted to take the kids fishing, and they were going to take them to a church that's next to the juvenile facility, and they have a little pond in front of the church, which happens to be my church. And I said, hey, Kevin, I think it might be more fun if you bring them to my community. I live in a lake community. It is a gated community. And I thought that would give them a different perspective about life. And it really did. The questions that I got from a young man, he was like, how do you get in here? And I said, well, what do you mean? He said, well, how much is the rent here? And I said, we pay a mortgage. And then it allowed me to have a conversation with the 18-year-old about what mortgages were and how he would save his money and what goes into it and how long it took for me to get here. It took me 24 years of working really hard, of living in one of the worst neighborhoods in the city of Detroit, with about a combined income with my husband and I of $3,500 for the year. And I tell people, hanging our groceries out of the window in the wintertime because we didn't have a refrigerator, to living in one of the most beautiful gated communities. And what did it take? It was accountability, taking a few Dave Ramsey classes, connecting ourselves with people that were going to teach us, because we had no idea about financial stewardship. So this allowed me, just bringing him outside of an environment, to see a community where people looked like him in that community, to say, man, I can be here one day, and I'm gonna strive to do this because I know that I can, despite where I come from. And so that's how we have to be able to look at that high control and high support as well. Just the simple things of being able to take them out of a community. And that's what I love about Lake County and what they're doing with regard to prevention, intervention, and diversion, is being able to give kids a different perspective. It was something that we were able to do in Detroit, is that I had a church adopt my kids. They gave me $23,000 to take my kids to one of the best camps in the country called Camp Kopanaknik. All these kids, we took 3 sets of gangs from all over the city of Detroit, from different communities, and we brought them together for 5 days of camp at one of the best camps. And I can tell you that experience changed many of their lives. And they were totally different individuals, and just giving them that. And it wasn't something that the government could do for us at that point. It wasn't, I wish that, we had that prevention dollars there, but I thank God for those faith-based communities that were willing to invest those kinds of dollars. And I think that that's what Mr. Milner and Mr. Kelly and Ms. Stigdon was talking about, is those community connections where they see the investment in these young people. And that was quite an investment from that congregation to put in our children. And I know many other community philanthropic and churches are doing the same for kids. And that's how we help create a new identity for our young people. And I want to make sure that I'm staying on time here. Okay. So when we look at a framework for a restorative philosophy and how we work with people, we say conflicts or disputes arise from the breakdown in relationships resulting in a breakdown in the community. We are seeing that today. Our inability to be able to communicate with each other or to agree to disagree, whether it's a political or our religious beliefs or anything, this is what we are seeing. And the resulting harm and damage or the disruption should be addressed by those involved and impacted by conflict, disputes, or incidences. And that's why I think that family group conferencing is great. And that's what I love about restorative circles. I know a lot of communities have done community circles with regarding this, but I just really wish it was on a broader level of being able to have these great conversations facilitated by great moderators that really know what they're doing and to bring community together to help restore. So a restorative approach recognizes the capacity of all individuals and the community to identify, address, and resolve their issues and problems. And that's what they can do. Families are strong. My family was strong. It just took some great discipleship. It took great people investing in me, youth pastors. My husband would not be who he is today if it were not for a guy named Sam Glover that came into his life as a mentor, a volunteer at his school, and just sort of adopted him and taught him what it was to work hard and to be a man. And he was a Ford exec, just a great guy that's been in our lives, and recently passed away 3 years ago. And was there for our marriage and for our children. And all along the way, walked my husband through manhood, because prior to the streets were teaching my husband how to be a man. And he was the epitome of what we see a lot of young Black males in today is selling drugs and you know, living a life that really is more destructive. But somebody came, he says, my husband always says that he came between his grandmother and Sam, they came and pulled him out of the bowels of the earth. And he always says that today. And so it has allowed us to change the trajectory for our children. Our children have not experienced the things that we have experienced. I don't think they even understand, but we often take them back to the community for which we started. We always remember where we came from because that's super important so that we know where we're going. And that's what we have to help others do. And that's why my husband and I are so passionate about mentoring and having other children in our home so that we can model what this looks like on a real level. And it is super important as young people are coming out of foster care. We've had the privilege of becoming what we call permanent families for adult kids without families. And we have family dinner and they come over, and Mondays we have kids. And I think that that's super important, is that we no longer have a financial responsibility, but we have a responsibility as a community to make a home for them so that they have Thanksgiving and they have Christmas and they have Sunday family dinners in a place to belong that makes them feel like they have a family, to do those baby showers and all those different kinds of things for them, which is super important. So when we look at, and I'm gonna go through a little bit faster. I'm not gonna get through the aggression and all that stuff. I'm just gonna go through so I give you guys some time to ask some questions. So when we looked at building a framework, one, I talked about it, an influential adult models restorative practices. And when I say restorative practices, it's the language, it's the with box, it's the philosophy that every human being can be a contributing member to society, and their intrinsic value allows for them to pour into my life. And that's something that I've learned over the years, that I'm just now getting a degree. So it wasn't my degree that made me who I am or gives me my giftings. It just tells me that I can have a job, a 9-to-5 job in a place that I'd like to work. But it really allows me to understand the value of every human being, despite their title, despite where they come from, that I can learn from everybody, and creating a physical environment that promotes a culture of care. And that's super important. When I go into schools, and I've been a consultant for years for schools, the schools that show they care are clean and neat. They don't smell bad. The classrooms look good, and it shows that somebody cares about them. An emotional environment promotes a culture of care. It's another thing is when you walk into an environment, does it show that these people care? How is a social worker dressed? As a police officer, you know, I've interviewed many criminals, and a lot of criminals will say that they will try to fight a police officer or take their life based on how they're dressed or whether or not they've maintained their uniform or their health, because they think they can take them. And that's quite interesting, that while we don't want to judge people based on how they look, we are being judged based on how we look. And so I always kept my boots shined and my uniform neat, and tried to maintain that physical stature. I wish I was disciplined now as I was then, but I'm not. And expectations and practices are focus on restoration, a community of care, collaborative expectations, and cause identified discipline and accountability versus symptom treated discipline and accountability. And often that's what we do. I know that, I can't remember if it was Mr. Milner or Mr. Kelly that talked about counseling that quite often never helps. And I hear that a lot of times I'm usually the last person where they've sent their kids to counseling, a family's gone to counseling after counseling, and tag I'm a life coach, and life coaches look a lot different than counselors. While we give counseling, a life coach tells you what to do and how to live, and it's a lot more accountability, and you probably have gotten to your wits end with yourself, and you've done a lot of self-reflection if you get to a life coach. And so that's that thing. We don't want to treat the symptom. We want to look at the cause. And that's what I've always looked at. And that's why I chose forensic psychology, because it looks at the cause and the why, and past things to get to a solution, to find out what caused that harm and how do we deal with it. So I'm going to open it up now, Julie, for questions and allow folks to answer questions.
There is one question here, and that is, have any new ACE been added?
I don't believe so, because like I said, there is not just one or interrelated. When you think about, because you can look at the ACE scores and you look at the test, the most recent test that I pulled up was last year, I believe. And they're pretty much all the same, because when you look at drug or addiction or crisis, they all can encompass something. So the death, the loss of a loved one, that could be all encompassing. Sometimes they're more specific, and you can pull up different ones that may be more specific, but they still hit the 10 criteria. And how those, in my training next week, I'm going to address, long-term trauma versus the situational crisis, and how that impacts. And so that might be an answer as well. That might help answer that if they attend that class next week. That might help them look at some of the differences between a situational kind of thing, such as the pandemic, such as the civil unrest and everything, versus a long-term crisis. Hopefully that answers that.
So Monica, I do have a question. How do you deal with those individuals who really believe that if you get an ACE score or 4 or more, that there's really no way of coming out, or there's no hope for that child? I hear that a lot, especially in the educational system. How do you deal, or how do you address that with those individuals?
So I would say, I think I've been to every state in the country, and I've consulted probably about 15 different school districts around the country who have that same dilemma or belief system. And teachers quite often believe that. And so what I do is I model restorative circles, and I focus on the value. So quite often what I do is I pull out the thing that usually is the deficiency in the child becomes their gift. So say if mine was talking too much, my gift is communication. And so what I do is I'm very explicit in my practice and modeling what that learning would look like. I'll use Lake Ridge schools for an example. I did Calumet New Tech, and there was a teacher that was struggling getting his kids to want to do business. And his answer, his statement to me is, these kids have no intrinsic desire to learn. And in my mind, I thought he needs to be fired. But I modeled the classroom. I said, okay, so let me model this for you. And they asked me to come in and model what that learning would look like in that classroom where these students had no intrinsic desire to learn about business or anything. So of course, I'm like a substitute and we're gonna have the joking and stuff, but my gift is behavior, so I can get the class ready and managed. And so a young man says, well, he said, I just wanna start a restaurant that sells all foods with marijuana in it. I said, that's awesome, very creative. I said, so what I need you to do is I'm going to ask you to go to the corner, and is it okay as teacher, can he pull out his phone? I need him to find what the cost of insurance might be for that, you know, what states he can practice in and all those things. And the teacher's looking at me like I'm crazy, like, why are you feeding into this insanity? No, the thing is that by the time the young man got done researching, he learned something. He said, I can only do it in Colorado. I don't want to move to Colorado. He said, the insurance is going to be astronomical and I can't make any money. He says, so I've decided that I just want to do grilled cheese. So like a grilled cheese thing. I said, okay, well then you might have to compete with what restaurant, you guys? The Cheesecake Factory. So then now we're having a whole conversation with what he believed no intrinsic desires. No, it said you wanted to do things to kids. You didn't want to do things with kids. And so that's when I'm consulting, I'm modeling and I'm looking at every gift in that room. And it is our responsibility to discern those gifts by what we're hearing. You have to listen to your constituent. What are they saying? What they're saying is, Mr. Such and Such, you're boring, you're really annoying, and you want us to listen to you, but you're not listening to us. That's how I deal with that.
So there are a couple of questions. One question is, how do you recommend using ACEs with families, if at all?
I do it, have always given the ACE. I even give it to my students at school. So there's one for children that's for age appropriate for them. And when I go in, I give it to them. And most people say, why would you do that? I also give them the resiliency test so that they don't feel like they're horrible human beings by the time they get done taking the ACE test. As soon as we're done with the ACEs, I give them resiliency. There are, and I'll try to send that to you guys, the ones that I use for young people and the ones that I use for families, because it answers the why. If somebody had told me 20 years ago, the why of why I was so promiscuous when I was trying to break the stronghold over my life and could not figure out how to do it, I would have been so relieved. But the shame that was attached to it, until I really learned or came into what I call the knowledge of the truth behind the behavior, there was no way to heal because I thought I was this terrible human being that was going to hell, that there was no, God couldn't deliver me, nobody could, and there was a stronghold, and it was affecting my marriage. It affected, you know, everything. You know, to everything. If I had never understood why, what was causing this, and then I do have some power and authority to overcome these things. And that's why it's so important to let people have that ACEs test to help identify, oh man, this is why. That's one of the greatest things that my kids love is when I give them the ACE test. And that's my 6th grade to 12th graders. I don't give it to them any younger than that. I don't think they'd understand, but 6th grade to 12th grade, I've always given them one. I have one that's made specifically for young people. It even asks the question, have you ever lost a pet? And it sort of deals with that kind of stuff, like that can be very traumatic or impactful. So that kids can understand in their level that the loss of a pet can be the loss of a loved one. So it sort of is a little bit less invasive, but it also leaves it has a little box on it that says, is there anything other that you feel that's been traumatic? So it allows them to fill in anything that they believe has been harmful to their life as well. So I can send that as a part 2 after this if anybody like it.
Okay. The next one is, could you describe your restorative justice work in more detail and how it informs your restorative practice approach?
So when we look at restorative justice is a reactionary response to it's after the fact. So that's when harm has already been done. And I've done it I don't even know where to begin. I've done thousands and thousands, I think, of circles, but I'll give you one most impactful as far as community. We had a big gang fight. We had gotten the gangs under control in Detroit, especially in the Cody Rouge area, which Cody made national news, has always made national news in that area for the city of Detroit, because it was one of the most violent areas. We were able to get what we call a ceasefire. The problem occurred was one of the younger kids, we had what we call safe zones. That would be what we call Don Bosco Hall, which is a community center. There was no gangs. They had made a promise that they would not do any fights there. One of the younger individuals jumped somebody in another gang up at Don Bosco. That was a big, big no-no. That was, and it made the core leaders of the gangs, the older ones, look bad. So what we did was we brought law enforcement together, community members, parents, and all the gangs together. I think there's probably about 75 people in that circle with 3 facilitators, and probably about 4 police officers who were impacted, and just how it makes them feel, you know, and how it makes them feel as a parent, as a police officer to have to arrest or to feel harmed, but also allowed for the community, the parents, the teachers, the leaders of Don Bosco. And after that, we were all eating pizza together. And we always break bread, You better have food after a restorative justice circle. So that's a reactionary, that's in response. Restorative practices is where we begin to implement it in schools, in the law enforcement and everything. So in Detroit, we trained 300 and something police officers in restorative practice. That's the language. So and that's why you don't see so much disruption. The community in Detroit has a great relationship with police. There are community restorative practitioners at every precinct. So from the commanders have been trained, and that has to do with language, and they are part of our crisis team. So the crisis response, they're trained in mental health and triggers and all of that, and that language. So the language is super important, and language is that we hear you, we see you, we value you, and every week or every other week, there are restorative conversations at the precincts where it allows community members to come have a circle and talk to law enforcement on a real level and get their input to creating that. And then in addition, we trained 300 and something blocks through Skimmon Foundation, which is the philanthropic foundation in Detroit that has gone out and now invested in training block by block by block, and each block has a community member that is retrained restoratively to help deal with conflict within their community. And yes, they still are a very violent community in that sense, but they are really doing well in the sense of the non, you know, you're going to still have some of your gang violent stuff, but when we look at the violent crimes that are like armed robberies and stuff, all of that stuff has gone down because the community has been able to work with police on a real level.
So can you explain again the building a framework for practice chart?
Okay, so the social discipline window and building that framework is that we don't want to be punitive. We don't want to, in schools quite often we'll kick kids out or, you know, we'll fire somebody. That framework says, okay, high control. We want to hold you accountable, but the with box says we want to work with you. What are the tools? So we identify that there's a problem. Now we want to give you the tools to be successful, and we expect you to be successful because we're going to work with you and build that and look at what your gifts and your talents are. But when you're looking at the bottom block, we don't want to be neglectful. We don't want to do anything at all. And that 4 box, I would say, is the easiest box for us all to fall into. And that's the one we have to be aware of because of our jobs, because we love people, because we are compassionate, it's really easy to want to do things for people. You know, I say the backpack program for schools and giving them food is probably a 4 box. And what I mean by that is that we assume that every child on the weekend is not going to eat. So I don't know if you know about those communities where they fill the backpack with food and we want to make sure that kids have food. That's the 4 box. They didn't ask parents, did they need it? They didn't engage those parents in the conversation of what this would look like, or did they ask anybody to invest anything? So young people might say, okay, on a weekly basis, the classrooms are going to rotate in gathering the food, baking the food, putting it in different areas. So there's no contributing factors by the community with regard to that backpack program. That is the 4 thing. It's not that we shouldn't have it, it's that who did you involve in creating it and how can they be contributing members of it so that they have some buy-in of it. That's that social discipline window. So we want to get to the with box. We want the backpack, we want to make food available on the weekends, but we also want to allow them to contribute to that program. Hopefully that helped.
Thanks, Monica. Okay, so do you have any specific recommendations for helping the North Lake County community, which has some of the area's greatest challenges?
Well, I would have to do some homework on North Lake County. And I've always made my phone number available because I would have to hear and see what their needs are. That's listening to the community. That's the only way that I would be able to say that. To be able to take a real restorative approach, to be in the with boxes, to know, understand, and listen. So I don't mind making my email available to anybody, as well as my cell number, because those are where those conversations come in, so that I can hear and give you the right feedback.
And the last thing is, can you tell us more about the leadership authors that you admire?
Oh, I love Stephen Covey, John Maxwell, Tony Dungy. I mean, as far as books go, I could probably just show you my shelf. Just about anything. H3 leadership, creating emotionally healthy communities, anything. And I got John Maxwell's certification about 3 years ago, and took his whole program, which was awesome. And so there's, I mean, plenty. And if somebody wants to email me, I'll send you my reading list. And if you're Facebook friends with me, I put my reading list up every year for December. So in December, I choose 5 books that I'm going to read throughout the year to help me grow.
Okay, we have another question. So how would you deal with an ex-foster child using your methods?
Okay, so I've had that. I think is when they call, or if they're struggling and they're so, I just had one, and she sent me a text message and said I got kicked out of my foster home. And so my question is, so what can you do to make things right? So I never say, what did you do wrong? And I never say, what did they do wrong? The assumption is what needs to happen to make things right. And so it's hold high control and house support. And then, so what would you like me to do? This is what I can do. I can pray for you. Do you want to call and talk? You know, what did your social worker say? So I'm going to ask them, you know, who, what, where, why, and how, and those things. But really, I'm going to give them focused conversations of that fair process. I'm going to engage them in a conversation. I'm going to explain to them what I think can happen and listen to them. And then I'm going to have a high accountability. So engage, explain, and expectation on what that would look like. So what came out of it is that, oh, well, I was a little disrespectful. I was sort of really disrespectful. And what can you do to make things right? You know, how do you make that right? So that's how I dealt with that. And that was recent. That was like 3 days ago. That child called me about the other foster home. And my husband and I don't do foster care. We only do emergency. So this young lady was in our home, like I said, of the ones that I said a few months ago, and for a short term. So we just did that emergency, and she contacted me about her solid foster home. So hopefully that answers that. I do address, quite often I get calls from my past kids in guardianship and stuff.
Okay. There are a couple of statements in here that I'm going to read. One says, I have found great success using restorative circles in my elementary school when dealing with a child and their peers. However, I struggle with adults who are very punitive, who are in the circles, even with a conversation beforehand, who still try to justify their position. I'm not sure what other approach to use to help get those adults on board with restorative.
So you're going to always have what I call a curmudgeon, and that's their own shame. But you have to be a strong facilitator. And I'll use an example. There was a teacher that was like that and just want to be set in their ways. So my response is when I repeat what I hear, how I hear it as a facilitator, I say, so what I'm hearing you say to make things right is that you no longer believe that your teaching is effective. And that because you chose this profession, it's probably time for you to retire. That's how I address it. And as I said, as a strong facilitator, you have to be able to control your circle, and you have to be able to control the outcomes of that circle. And so I still maintain the effective statements. And an effective statement is saying to them, so what I'm hearing you, and then I allow them to address it. So, and what I'm hearing from you, a true statement. Of course, they're going to say no. And I'm going to take them back to the last question for that teacher. The last question is, what can you do to make things right? Ask her to make sure, well, she can hear me. Flip your card. So treat that teacher as if they're the person that caused the harm. So if you're doing restorative circles, there's a card, and I'm going to pull one out, and it's got two sides to it. It has one that's been, excuse me for 1 second. Give me 1 second. I'm going to grab you a card so you can see it. So there's a card, and it's got side 1 and side 2. Side 1 is for the person that caused the harm. Side 2 is for the person that's been harmed. I would suggest that you flip the card and treat her as if she's the person that caused the harm, and ask her what can she do to make things right. And that's usually what cures that ailment for curmudgeons.
So Monica, thank you again for joining us today. I look forward to next week's presentation, and hopefully we'll have some of the same people on so that we can continue this discussion.
Awesome. Thank you guys for all of your questions and everything, and challenging me. I appreciate it. See you next week.
Thank you so much for joining us.
Thank
Have
you.
a great day, everybody. Thank you guys for joining us again today. We'll see you next Friday.